Hey Jack, it's Dr. Roy. Here's your case loaded up onto the digital platform for Invisalign. Um, I wanted to go over a few things and a few options with you for your case. So as we had discussed, you've chronically worn a over-the-counter mandibular advancement device, which has caused quite a bit of protrusion of your maxillary interiors. When we're all said and done this, we're going to hopefully convert you to a much more rigid and stiff than dental fabricated mandibular advancement device for the treatment of your sleep apnea. But unfortunately, this is where you are, and we need to get you out of the pickle. So as we can see, you presented with a posterior open bite, inability to chew. We took a good look at your joints, and your joints look healthy, um, at least healthy based on the position that you were able to go into with this interference in the front. It is somewhat difficult for us to assess the health of the joint without it seating because of the interference here. With that said, we have a pretty good idea the joint is relatively healthy. So we had met and talked about using Invisalign to take these teeth and procline them forward in order to create some overjet so that your back teeth can come together. We'd obviously close all the spaces on the lower in order to gain some access. But what I'm confused about is the fact that you had your upper premolars removed when you were a kid during your orthodontic care, but the way your jaw lines up now, I'm perplexed on why they did that. And I think you had said that that was less than favorable, or you made a comment to some extent on that not being the ideal outcome. And that's neither here nor there. That's historical. All we're going to do here is try to present you with an option moving forward. But because you're missing that, and I don't necessarily think you had the skeletal structure to warrant that kind of removal. If anything, removing a lower because your skeletal structure is almost class 3 based on this image right here. So again, I'm a little perplexed on why they did that. With that said, what's in the past is in the past. But because of that, in order to solve this, we almost have to do something like this. So this was Invisalign's first proposal, was that we need to leave space somewhere in order to get this overjet. There are alternatives. We could do some slenderizing of the teeth on the lower arch, but my concern is I don't want to retract any of your teeth because you have sleep apnea. I don't want to, maybe this will make more sense. I don't want to bring these teeth back this way. So one method to solve this problem is to do what's called IPR, where we reduce the tooth structure between the lower teeth in order to increase the overjet. That can work in some patients, but it's contraindicated for a patient who has sleep apnea. So we're not going to get our space by reducing on the lower. So all that really leaves us is the other option, which is to create space on the upper. So that's definitely going to be part of the solution. I really don't see there being any other way other than removing your forefront teeth for us to get your lower teeth to come back together, which I don't think is something you're looking to do. So if we accept creating space as a potential avenue for us to solve your problem, the question is, where do we put the space? One option is behind the laterals. Another option is to put it behind the canine. Another option is to actually spread it out across all of the front teeth and then use veneers to restore the teeth accordingly. Honestly, I think what we do is we actually get you here just to get your jaw closed first, and then we can have the conversation about what it would look like if we did veneers or just left the space there or left the space here. There's several different options that could get us to the finish line. So maybe a little bit of guidance on what you think you'd like to do. Is leaving a space acceptable to you? My guess is no. If you are open to it, it would be likely a cost-driven perspective. Where would you want to put the space? Would you want to put it right here or behind the canines. Um, there's a lot of differing opinions on which is better. Personally, I would go behind the canines if you're going to do it. But my recommended method would be that we equal out the spaces all the way across the anterior teeth and then restore it with veneers and or composite veneers. So looking forward to your thoughts, and let's continue conversing by email until we get to a better understanding of how to move forward with this. Also, if you could give me some idea on your budget. I know we talked a little bit about it during our consultation, but having some sort of guidance on the financial part of this might help us decide what's best. So I just want to lay out all the options for you so that you have the best decision in front of you, and look forward to continuing the conversation. Have a good night.